Hello, Dr. Caleb Frank here with the Sarah Life Center. Today I wanted to talk about some of the common causes that can lead to infertility and pregnancy loss issues, whether miscarriage or stillbirth. If you're struggling with infertility, a good place to start would be to have a good structural exam done by either your OB or a fertility specialist. A lot of times they'll go through and look at uterine shape and look at the fallopian tubes. If the fallopian tubes are collapsed, that can prevent fertilization of an egg. I actually had a family member who struggled with that. Once they had that issue dealt with surgically, they were able to get pregnant and then eventually have three children in their family. So another thing to have checked out structurally would be the uterus shape. A rare heart-shaped uterus can have a layer of tissue that comes down in the middle of the top part of the uterus, and it can lead to difficulties for implantation of the egg. Even if it's been fertilized, it might have a difficulty implanting in the uterus. And also, as the baby continues to grow and develop and the amniotic sac begins to fill up and expand, it can lead to putting extra pressure on that amniotic sac and lead to a premature rupture or the water breaking early, kind of like my wife and I experienced, although ours was not due to a heart-shaped uterus. Another thing to be concerned about when it comes to infertility or pregnancy loss is some other interfering health conditions. These would be conditions like endometriosis, uterine fibroids, or PCOS. These conditions can interfere with normal menstrual cycle, with the hormone regulation process, and just make it more difficult for conception to occur or for the sustaining of a pregnancy. Another thing I'm going to discuss in depth in another series of videos is going to be hormonal imbalance. Improper levels of progesterone and estrogen can really hinder or interfere with the ability to conceive and sustain a pregnancy. Sometimes stress is a big factor involved in this, especially with estrogen levels, because estrogen and cortisol, the stress hormone, share precursors in their synthesis process. And when your body goes through high stress events or prolonged stress events, it's going to prioritize the production of cortisol over the production of our estrogens. Another thing to consider when looking at infertility and pregnancy loss is genetic factors. Obviously, there are some genetic factors that the hospital or your OB will look at, but doing a full genome analysis will be beneficial because we can look at not only specific genes, but also how it goes through the methylation cycle, especially folate metabolism, which is vital for healthy sperm and healthy eggs. That was actually an issue that my wife and I struggled with. And it allows you to have further answers or further steps that you can take to support a healthy pregnancy and hopefully lead to a healthy baby delivered at the end of that process. So these are some of the common causes of infertility and pregnancy loss that we're going to address in much greater detail as we continue through this video series. So make sure to like, subscribe, and click that notification button so you can be up to date with all my videos as they're coming out. If you need some help in your own personal journey to parenthood, feel free to click on the link in the description below to go to our clinic page where you can set up an appointment. We do free 20-minute consultations. Till I see you, take care and be blessed.